Alright, hi, my name is Mykira. I'm going to be your nurse today. So today I'm going to be testing your deep tendon reflexes to elicit a stimulus response. The tendon will cause a response along the nerve, but there are 3 in your upper and 2 in your lower extremities, okay? So first, before I begin this assessment, is it okay if I record you?
Yes.
Alright, and then could you verify your name and date of birth?
India Armand for 22,000.
Okay, and are you having any pain today before I begin? Alright, so first we're just going to start with your upper. Make sure you're relaxed, okay, during this process. So this one I'm going to be testing your brachioradialis. And so I just want you to relax. This is going to test your C5 and C6, your C5 and C6 nerves. So just rest your forearm on your hand, in my hand. And I'm just going to go about 2 to 3 inches above your wrist. And I'm just going to strike. Okay, all right. So you did have normal flexion and supination of your forearm. Following this, I'm going to do your bicep reflex, and this is going to test your C6 nerves. So I just want you to have your arm straight out and make sure that you're relaxed. And in the antecubical space, I'm going to locate that. I'm going to place my thumb on there, on the tendon, and I'm just going to hit my thumb, okay, lightly. All right, so you did have a normal contraction of your bicep with a slight flexion of your forearm. Following this, I'm going to do your tricep reflex, and then this is going to test your C6 and C7. So for this, I'm going to do about 1 to 2 inches above your elbow, and I'm going to find the deep tendon insertion, and I'm just going to hit it, okay? All right. So I just hit it, and I see that you did have normal contraction of the tricep muscle and extension of the forearm. All right, so now we're just going to move on down to your lower extremities, and we're going to test your patella reflex, and this is going to test your L2, L3, and also L4 nerve, okay? So now I'm just going to sit, okay? So just let your leg dangle, okay? So I'm just going to place my hand right here, and I'm just going to hit, okay? All right, so your leg did react to that, so that looks good. Next, I'm going to do the Achilles reflex, and this is going to test your S1 and S2. So I just want you, normally I would lie you down, but since we have constricted space, I'm just going to get you to just hold your leg up for me and extend it, and I'm going to support your foot. And your foot is dorsiflexing, so as I'm holding it, I'm just going to strike your Achilles tendon. So, all right here. All right, so I'm just going to strike. There we go. Perfect. Okay. So you did have normal plantar flexion of the foot. All right. So that does conclude our assessment findings. India, everything did look normal and intact. Thank you.